Hi everyone, and welcome to Lesson 7 of the Medical Care Organizations course. Lesson 7 is going to be all about outpatient care and primary care services. So this actually might be probably our shortest lesson, okay? For the most part, we're going to be going over a lot of different types of services that count as either primary care, outpatient care, or both. Okay. So, outpatient care and primary care services. Outpatient care has existed before hospitals and nursing homes. Outpatient care actually means, outpatient care, that means walking. Another word for outpatient care is ambulatory, so I'm going to write that right here. Ambulatory care. We're going to actually see this on another slide, but I just want to let you guys know right now. Another word for outpatient care is ambulatory care, although we don't necessarily use it too much out there, especially in healthcare as a healthcare professional and whatnot. I feel like it's more of an academic word. Just because I haven't heard it out there in the world, I only hear it in academia. But ambulatory care is another word for outpatient care. And ambulatory actually means walking. And I believe we are going to see this in another slide, but I'm just going to let you know this right now, because we're going to talk about why it's called basically walking care. And the reason why it's called walking care or ambulatory care or outpatient care, like outpatient, is because this type of care is done outside of the whole, being admitted and staying overnight in a hospital. Okay, when you get outpatient care services, you don't stay overnight anywhere. You go into the facility, you get your services, and then you go home. Like, you go somewhere, you get your treatment, and then you go. Or you might be getting your treatment at home or anything like that. So outpatient care, ambulatory care is walking because you walk in, walk out. That doesn't necessarily mean that everyone is going to be walking, but that's the general idea. Okay, that's why they call it walking, is because you're kind of in and out. You don't stay overnight. All right, so staying overnight, being admitted into a hospital, and that type of care is called inpatient care. Okay, that is inpatient, and that is not what this lesson is about. So inpatient is staying overnight in a hospital or healthcare facility, or something like that. Okay, being admitted and staying overnight. That is inpatient. This is not inpatient, it's the exact opposite. So actually, most care is outpatient care, and outpatient care has been around since forever, okay? Because we always go places or go somewhere to receive care, or maybe the physician or the practitioner will come to our home or things like that. Okay, so a lot of care since before hospitals have been created has been outpatient care, just because that's what it was before hospitals and before people started staying overnight in a facility. Okay. Anyway, so that being said, hospitals, I don't want to say that hospitals don't do outpatient, because hospitals are actually a huge player in outpatient care services, especially these days. Hospitals provide a lot of outpatient services, okay? And we'll get into why that is. Actually, we've already kind of touched on it a little bit when we were looking at financing. So remember the whole story about the Medicare reimbursement shift going from cost plus reimbursement to prospective reimbursement? That whole shift caused many hospitals who wanted to stay in business to focus on their outpatient services. Okay, because if they focus on their outpatient services, they're still getting the same money whether it's inpatient or outpatient. But if you can bring more of your patients to your outpatient departments, your outpatient units in your hospital, then you're going to be able to make more money that way. Because as an inpatient, your inpatient units, those are going to be super expensive because you have to staff them like you have to have 24-hour staffing for those beds. You have to have food and of course electricity and equipment and everything like that. And you have to have, of course, nurses, admin people, CNAs, the whole enchilada for those for inpatient sections. So it's a whole lot more expensive for your inpatient services than outpatient, okay? Because it's so much more than just providing a treatment, okay? Outpatient is more about just providing that treatment, that service, and then let them be on their merry way. And for that reason, you make way more money providing outpatient services than inpatient. So that is why many hospitals are like, let's get into the outpatient business. All right, so we see a lot, many hospitals have become major players in the outpatient services. All right, so hospitals really actually capitalize on medical technology and everything like that so that they can really invest in their outpatient services. Okay, many hospitals out there are like state-of-the-art outpatient units, and then their inpatients are just kind of like, hold to bed and stuff. We'll take care of you, but the real magic happens in the outpatient, okay? Because that's where they want you to go, because that's how they're gonna make their money. So also, as a result of many hospitals and many people focusing on outpatient, because that's where the money is, we got hospital labs, diagnostic stuff, everything like that. We're just way better equipped, and we focus on creating the technology, the medical technology that would allow for this, that would allow for faster recovery times and better diagnostic equipment and things like that, so that we can make more money off of it. Okay, that's where the money is. And many solo practices, actually, as outpatient started to grow, especially in hospitals, a lot of solo practices have, they struggled a lot during, as outpatients started to grow in the hospitals, because now they're competing with the hospitals, and the hospitals have all the capital, they can invest in all the best equipment and everything like that, and the poor little solo practices are really struggling to keep up. So we're going to see later on in this lecture that like many of these solo practices decided to team up with other solo practices and form larger multi-specialty group practices and make way more money that way. So anyway, let's move forward. All right, so here is sort of this array of different types of outpatient services that may be provided. Okay, so outpatient care is more comprehensive, okay, and there's just so much care, that so many different types of services that fall into outpatient. Okay, so first, I know we've already talked about how ambulatory care means walking. Ambulatory care is another word for outpatient care. So over here, we have different types of outpatient services. We got primary care. Primary care is a type of outpatient care, although primary care alone is its own form of care, which we will go over. Then you have specialty care, which in an outpatient setting, you can receive specialty services and specialty consultation and whatnot, and that would all fall under outpatient care, as long as you're not taking your specialty care over to the hospital and having your patients stay overnight while you provide services. It's going to count as outpatient care. Okay, same thing with labs. When you go out to the lab and everything like that and get your blood work and all of that, those count as outpatient care. Pharmacy, drugs and things like that, outpatient care. And then of course, like we just talked about in the last slide, hospitals have invested so much into outpatient care services. They provide a lot of different services for patients who are not going to be staying overnight. They're just going there, they get their treatments, and they go. Okay. So primary care, we should all be familiar with what type of care primary care is. Okay. First of all, there are 3 different levels of care. We got our primary care, then we have our secondary care, and then you have tertiary care. And I know I've said before, do not get care mixed up with prevention. Remember how we had primary prevention, secondary prevention, tertiary prevention? This is not the same thing. Okay, these are different levels of care, not different levels of prevention. Okay, so primary care stuff. This is all of, now we're going to focus on the primary care, sorry. So primary care stuff, this is your basic care, your routine care, your continuous care. This stuff is all coordinated by your primary care provider, who is probably a generalist, a physician who is a generalist, or in many cases, actually, we can have like nurse practitioners and physician assistants be like your primary care practitioner as well. So that's why it's probably safer to use the term primary care practitioner instead of primary care physician. Although there are plenty of physicians who are generalists and provide primary care. But anyway, so primary care, your primary care practitioner knows you, they know your medical history, they provide you with, they coordinate your care, okay? They are there to deliver a large amount of services, but they're all more generic type services. It's like generalists pretty much know a little bit of everything. Okay, so the type of services that a primary care physician will provide for you will be your primary and secondary prevention services. Sometimes they'll provide tertiary services for you, but many tertiary services are actually a job for, or even tertiary prevention services, kind of a job for a lot of specialists out there, because it may get more complicated, or that may be done in the hospital. But a primary care practitioner will do a lot of primary and secondary prevention services. Okay. They also are typically, their job is to really partner with the patient, okay, become more of have a partnership with the patient, and so you both make a collaborative team effort to work on the patient's health, okay, keep the patient healthy, maintain their health, and that's really the job of the primary care practitioner, is to maintain the health of the patient, okay. So normally they are the ones who know your history. They're gonna be there to coordinate your care. If there's anything going on with you, they'll be the ones to prescribe you any kind of diagnostic testing, or they will run their own diagnostic testing on you to figure out what's wrong with you. And typically they will, if you do need some sort of specialty consultation or specialty treatments, they're going to be the ones to create that referral and send you off to the specialist. And then they will be the ones to coordinate with that specialist and, you know, get the information from that specialist, okay, and then figure out how we can work with them and maintain your health. Okay, so a primary care physician or practitioner is very important, and they are really like your first point of contact into the healthcare system. Okay, primary care physicians are very important, and another reason why they're so important in this country or in, you know, anywhere, is that focus on primary care means, well, primary care physicians and practitioners focus on maintaining your chronic illnesses. Okay, that's kind of like their specialty. That's what they do. They help maintain your health, and along with that is maintaining your chronic illnesses. If you have diabetes, any kind of heart disease, kidney disease, anything like that, they're there to just make sure that you're going to whatever specialty care appointments that you may need, any kind of consultation. When you do need it, they will send you out to go get your specialty care. If required, they'll constantly monitor your disease and provide you your medication, try to make sure that you stay on track with everything. And then if anything flares up, or if you need a specialist to step in, they will send you on your way to go to see your specialist, or they'll hook you up with a specialist to go see. So this is pretty much everything that I just said. So enjoy this slide on your own. Okay. Now, secondary care and tertiary care. Okay, do not confuse secondary care and tertiary care with secondary prevention and tertiary prevention, not the same thing. So anyway, secondary care, just like primary care, it's just another level of care. Okay, most of the care that we require is primary care, most of our care, because mostly what we need is someone who can just help us take care of whatever flu we might have or any kind of minor stuff going on with our bodies, and then and any kind of maintenance of our chronic illnesses, and then of course diagnostics. If we believe something might be wrong with us, then we go see a primary care physician. They'll run tests and figure out what we need to do after. What's the next course of action? Now, next level would be secondary care, and secondary care usually will require a specialist. Secondary care can be provided by a primary care physician. It just sort of depends on like what it is, okay, what that thing really is. But for the most part, a lot of secondary care is going to be provided by a specialist, or even a technician, but it's going to be this is more considered like probably basic level specialty care, actually. Okay, so secondary care, usually it's going to be short term. It's not going to be it's not long term like a primary care setting. So this is going to be short term. A lot of this is going to be consultation with the specialist, maybe could include hospitalization, maybe routine surgery type stuff, rehab. This will all fall under the lines of secondary care, and most, at least, secondary care is going to be provided in an outpatient care setting. Okay, most of this will be provided in an outpatient setting. Mostly outpatient, not all the time. Many times you might require some hospitalization. A lot of routine surgery, especially these days, does not always require hospitalization. A lot of routine surgeries will just send you home right after the surgery. I know last year I had surgery, and it was a laparotomy, and I was sent home like immediately after. It was like I just woke up out of surgery while they were just sort of wheeling me out, and then I was just kind of like waking up, and then that's when they're just like, okay, great, you're back to consciousness. Let's get your shoes on. Come on, let's go. Let's change you back into your clothes and get you out of here. I could barely move, but it was still like, let's move you. Let's get you out. So, most routine surgery is kind of like that now. Okay, so next, tertiary care. This is the most complex level of care. Okay, this is the least common of all the different types of care, all the different types of treatments that you're ever going to require. A lot of us actually will probably never even reach reach that point where we even require tertiary care, because it's a lot more rare. Probably only about 5 to 10% of all the care that we require as human beings will be tertiary. 75 to 80% of all the care that we will ever require in our life is primary. Okay, so tertiary care is very rare. A lot of us may never need tertiary care in our life. It's the most complex level of care. It's for conditions that are typically uncommon or just emergency, crazy things happened. This is almost always institution-based. Okay, it's done in a hospital, right? Highly specialized, definitely going to be handled by a specialist. It's going to be more technology-driven, and this type of care, usually it's going to be large hospitals, probably teaching hospitals. Teaching hospitals tend to have the most equipment. They tend to be very technology-driven, and they'll have people who have a lot more experience and people who have been participating a lot in research and also teaching. So they have seen a lot of crazy stuff in their day, in their career of medicine. So usually that's where a lot of the tertiary care will happen. It could move into long-term care, but usually this is going to be more sporadic and very short-lived. Okay, so some examples of some tertiary care might be some sort of trauma, open heart surgery, transplants, burn treatment, things like that. Okay. All right, so outpatient care. Ambulatory care is usually rendered to patients who come to the physician's office, clinics, or outpatient surgery. So typically it's that type of a setting, right? Outpatient care does not require an overnight stay, which is what we've already discussed. A lot of ambulatory care can be considered or similar to more community medicine because usually it's surrounding the community. It's more convenient. You can accept, it's more accessible and things like that. So the scope of outpatient services. There has been a tremendous growth in outpatient services, even new different settings. New types of outpatient care, and even new types of ownership. And this is because of really a lot of this outpatient service growth started in the late 80s. Okay, because when, like I said, that we went through that whole, cost plus reimbursement switch to prospective reimbursement in Medicare, right? So Medicare changed how they want to reimburse the hospitals and the physicians. They went from the cost plus thing to prospective reimbursement. If you don't remember what that is, watch the chapter on financing and healthcare. And that's where I talk about exactly what that was. But the switch from cost plus to prospective reimbursement with Medicare caused a lot of facilities to just not be able to even stay afloat, just because they weren't able to get as much money as they used to out of the government. Okay, so for this reason, remember the prospective reimbursement system basically just gives every diagnosis that you make on a patient, you're able to give a flat fee. Okay, you just get a flat fee. So it really doesn't matter which service or what treatment you provide, or whether you allow that patient to stay overnight in the hospital, or what you really do with that patient. Medicare is only going to pay your organization just a flat fee. Okay, so if you're only making a flat amount of money for one diagnosis, no matter what you do with them, you're definitely not going to want to provide services for that patient that are going to be very expensive, unless you have to. You're probably going to want to steer everything to the cheapest option, okay, which is outpatient care. So This major focus on outpatient care caused a lot of research and development to create new medical technology that focuses on outpatient care, on ways that we can do diagnostics real quick, on treatments and procedures and surgeries and things like that that are going to be less invasive and allow the patient to recover very quickly and will not require the patient to stay overnight in a hospital. That is key. Doing things for creating services for these patients so they do not need to stay overnight in a hospital. So if we're creating a bunch of different services where people don't have to stay overnight in a hospital, we're going to create new different types of services. We're going to create different types of occupations, different types of technicians, different types of jobs, right, to work this technology that we're creating, okay? And then we're gonna have totally new settings. It's just like a whole new world of outpatient, okay? So we took it very far and we're very focused on outpatient stuff, okay? Even different ways of ownership now. So what this also caused a lot of people to do, because now, remember I said that a lot of the solo practices started to really suffer when the hospitals decided, we're gonna do outpatient. And then the solo practices were like, but outpatient is our thing. We do outpatient, you're inpatient, you're a hospital. Well, the hospital's like, so what? We got the money, we're gonna invest in outpatient stuff. All right, so that's where we're gonna make money. And so all the little solo practices were suffering and they were not able to get as much business as they normally could back in the old days. And so they really had to start creating alliances with hospitals, and they had to merge their businesses with other solo practices and create larger multi-specialty practices. Okay, and that way, if you create a large multi-specialty group practice instead of just your little solo practice that does like one different type of thing, then now you're opening up, you guys can start to consolidate all of your bills, you know, to keep your business running. You'll be sharing employees, so you don't have to hire too much labor. You'll be sharing equipment. And you can also bring your money together so that you can invest in all the new cool stuff that the hospitals are investing in. All the new cool medical technology that they have, you can also get. So now you can compete with them. Okay, so we see a lot during this time. That's where we sort of went. So we got new ownership, new types of stuff, new services, new settings, new everything, and it's all because of this whole shift in reimbursement. Okay, the way Medicare did things, they decided to change the way they're going to pay for these medical services, and everyone decided to shift their focus to outpatient, which actually benefited so many people because now we have services that are faster, that are less invasive, we can recover a lot quicker, so it's actually kind of a good thing. Anyway, now, so the scope of outpatient services. We got primary care is one type of outpatient services, but then again, not all, all of primary care is a type of outpatient. Of an outpatient service, okay? All of primary care is going to be considered outpatient, and the reason for that is because when you go get primary care services, when you go see your primary care physician, they don't make you stay overnight in their medical practice, okay? No, they do not. They don't have beds, they don't have anything like that. They're not a hospital. So they would be considered outpatient, okay? They are an outpatient service. But not all not all outpatient care is considered primary, okay? Not all outpatient is primary. yet all primary care is outpatient care. Okay, because outpatient has a gigantic scope of different type of services. Okay, primary care is just one piece of those different type of services. That's just one little section of outpatient care. So many different types of services will fit into the outpatient care umbrella, right? So some of those services are emergency room, urgent care, outpatient surgery, rehabilitation, renal dialysis, chemotherapy. Okay, all of these you're not going to stay overnight in a hospital for, so they're outpatient, and many of these can be done, or actually the hospitals usually have all of these different services, so the hospital makes a lot of money because they can provide all of this as outpatient, right? Even though there are other facilities that might be just for chemotherapy or just for urgent care, things like that, just for rehab, right? There might be other facilities that just focus on one thing, and that would be an outpatient facility, an outpatient care service provider, but hospitals are able to do all of it. Okay, so here's just sort of like a list of different types of outpatient and primary care service sites. Okay, so some different ways you can get primary care. And then this is really cool. I hope this puts things into perspective for everybody. Okay, so most of the service, healthcare service that we use in this country and really in the whole world, most of the service is going to be primary care. At 75 to 85% of all the care that we receive or that we require as Americans here in this country is going to be primary care. And why is that? Well, a huge reason actually is because most of the health issues that we have in this nation, it's not like we have mostly injuries, mostly violent injuries or car accident injuries, or mostly diseases that are infectious or things like that. What we have is mostly chronic diseases, mostly chronic illnesses, right? Because most of what we have might be cholesterol issues, obesity, diabetes, heart disease, kidney disease. Those are the type of things that are way more common for us. Okay, and of course we get sick every so often, and we don't need secondary or tertiary care for that kind of thing. If we have the flu, we're going to just get a primary level care and go home and get better, right? So for the most part, mostly what we require in this country is primary care, and guess who does the primary care? Oh wait, just kidding, I had to tell you. The generalists. The generalist physicians are the ones who provide us with primary care. So that's actually what we mostly need. Okay, and it seems like Europe got it right. Okay, because they focus so much on primary and preventative care services compared to their secondary care. We have more in this country. We have more specialty physicians, and we provide a lot of specialty care, which isn't what we actually need, than any other country, right? We've seen this before. Our specialty to generalist ratio is definitely off. We have way more specialists than generalists, which is actually a problem and probably why a lot of our healthcare expenditures are through the roof. But anyway, we do need more generalists, and that's the issue. We need more generalists. We need less specialty care. Anyway, so secondary care, like I said, part of secondary care can also be provided for by generalists. Your primary care provider can also handle a lot of the secondary care. Not necessarily all of it, but a lot of the secondary care. But a lot of the, and then, yeah, secondary care can also be provided for by other healthcare specialists, other healthcare practitioners, including specialty physicians. Okay, since a lot of secondary care is like specialty consultation and things like that, of course, it has to be provided for by a specialist. Okay, but how often do we need secondary care? Well, according to this, we only 10 to 12% of all the care we require, okay, collectively, is secondary care. So it's not that much. Next, tertiary care, the most complex level of care possible, right? Of course, this has to be done by a specialist, but how much do we need of this? We need 5 to 10%. Okay. So, given that we have so many specialists, way less generalists, what do we, many of our specialists will provide primary care. However, it's going to be really expensive when they do. Okay. And that is also what is driving up our healthcare expenditures. In the future, if we continue this, it may not be sustainable. Okay, so we do need to figure out what we actually need, and we need to focus on handling that. Let's move forward. So, why is outpatient experiencing so much growth? And we went over this so many times throughout this lecture, right? So changes in reimbursement. That is probably the biggest reason why we started to focus on outpatient services, okay? So we started to restrain our inpatient services, and when we started to grow our outpatient services because of this change in reimbursement, basically we do that so we can make some money, okay? Then, yeah, that's the main reason there. Now, some other reasons why outpatient care is growing so fast, so quickly, so much. Well, and it really kind of stems from the fact that it started with the reason why we needed to focus on outpatient care. It is because that the change in reimbursement, okay? But because of that change in reimbursement led to the need for us to develop new technology that was going to be less invasive, that we were going to be able to recover quickly from after surgeries, and we wouldn't even need to be inpatients for surgery anymore. We could just like leave after the surgery. So, of course, because we have been able to come up with so many different ways to do surgery and have new technology like that, we can grow our outpatient even more. Okay. Next is utilization controls. So also around this time, and we'll dig a little bit more deeper into this as we move forward with a few other lectures, but managed care during the 80s, the late 80s, early 90s, they've been around for a while, but during the late 80s, early 90s is when they started to really take off and become like almost commonplace, like within our healthcare system. Okay, and this is because during the time when the whole reimbursement change started, Usually when, and I think I've said this before, but usually when there's a huge change in our healthcare system, the private health insurance companies, they like to increase the premiums. I don't know how, like, they do, okay? So this is like a trend that always happens. We can always just expect, anytime something like this, something happens, something dramatic happens into our healthcare delivery system, the the private health insurance companies are going to raise their premiums. They always do that. Now, that doesn't necessarily mean they're providing better care or they're suddenly covering more services or anything like that. It just means for the same stuff, you're going to pay more for it. Even so, sometimes they may actually start restricting some of the things that they'll pay for, that they're willing to pay for, that they have been willing to pay for in the past. Maybe in the future they'll be like, we don't want to pay for that, but you're still going to pay us more for your insurance. Okay, so what happened was a lot of the employers during that time, okay, this is like late 80s, early 90s, a lot of the employers during that time who had to provide health insurance for their employees, okay, these employers had to spend, they were using the private health insurance companies. Those health insurance companies that do the fee-for-service, type of reimbursement with the physicians. And we'll get into what fee-for-service, actually I believe we already have looked at fee-for-service. Remember, that's when the physician will give like an itemized bill to the health insurance provider or health insurance agency, and then the health insurance agency will look at that bill that they build like all these each little thing, and then they'll just write the check, send the money over to the physician for each little thing that they did. So they just get paid for each itemized little thing that they provided, whether it's service or like resources that they had to give to the patient. But anyway, so the fee-for-service thing was not working out, and the employers, they hated the fact that the private health insurance companies, they started to raise their premiums, okay, and they weren't providing better services, they weren't providing more services, they just raised the premiums. So the employers hated that, and managed care ran with it. Managed care found a problem in the system, and they took advantage. They used it as leverage, okay? Managed care's whole thing, their goal, their objective is cost control. They love cost control. It's their favorite, okay? Their favorite thing in the whole world is controlling costs, and of course that means controlling utilization. They love that, okay? They love to restrict everybody and say, you can't use these services. It's their favorite thing in the world. So what managed care started doing was it was going to the employers and it was going, hey guys, we are going to charge you less money for your premiums because, okay, we can reduce our costs everywhere else. We control utilization, okay? There's no waste with us, all right? And there really was no waste with them because they controlled the crap out of utilization, okay? So managed care would have contracts with hospitals and contracts with, group providers and specialists and, all the physicians, right? And they would be like very restrictive as to what the physician was allowed to do for the patient, okay? So if the patient needs a certain service, there's a protocol of approval that the patient has to go through before they can receive that service, okay? Because managed care likes to control costs and utilization. Okay, they love it. So they have systems in place to make sure there's no waste. Okay, so since many of the employers decided let's all just go with managed care, they're cheaper, they provide, they control the costs. Let's do that as opposed to the private insurance. So managed care had a ton of beneficiaries that they were taking care of. And whenever they would get sent to like a hospital or just anything like that, managed care would be really strict as to like what they were allowed to provide for the patient. Okay, so managed care would almost like not allow much inpatient stuff like at all. Managed care was against a lot of inpatient unless it was absolutely necessary. Okay, managed care was like no inpatient stuff, and we only do outpatient, and we only do what's necessary, and everyone has to get approved for anything that you do. Okay, so managed care and the utilization controls moved a lot of the care over to outpatient because they were not willing to deal with inpatient and expensive care. Okay, plus there are definitely a lot of social factors. That's another reason why outpatient care has grown, because I mean, how many of you would rather be an inpatient compared to an outpatient? Just think about it. Do you want to stay overnight in a hospital for several days to recover from something, or do you want to be sent home as soon as possible? Do you want to recover at home, or do you want to recover in a hospital bed? A lot of people would say I'd rather be home. I personally like hospital food, so I might be like, can I just stay in the hospital for a day or two first and then I can go home? But many people out there would be like, no, I do not want to be in a hospital. That's depressing. I gotta go home. So that's also another social factor that helped outpatient care grow. Okay, the fact that more people prefer that anyway. Okay, so services that are provided. Here is a list of different types of services that are provided in outpatient services. Okay, so diagnosis of things, a lot of episodic care can be done as an outpatient service so long as it isn't too complex for the patient to actually need to stay overnight in the hospital. Prescription drugs, routine dental care counts as outpatient, physical and mental health care would count as outpatient as well. Okay, so shift from private practices. This has a lot to do with what I have been telling you before. Many of the independent solo practices were struggling a lot to compete with the hospitals during this whole shift to outpatient care. So a lot of these guys and women, so a lot of the physicians and owners of the solo practices, they got together. Okay, they decided we're stronger together. Let's merge our businesses. Because this way we'll have lower startup costs, we can share overhead, we can share equipment, we can share employees, we can share all the all the resources, and that way we can invest in better equipment and better stuff, so that would help us compete with the big guys. So they started creating a lot of multi-specialty large group practices. Okay, that would include like primary care physicians and like all these different other specialists under one roof to provide care, to all their patients, which actually benefited a lot of people because many people would, especially older adults, would be like, or a lot of those people who have like a lot of morbidities, different diseases and whatnot. It's really cool that they can have like a lot of their routine services done in one place. They can get, they can see their primary care physician and then they can go off and see their specialist within the same building. So they don't have to go to all these different places. Their people are all right there and all their physicians know each other. It's like an easy exchange of information and all of that. Okay, so because they're all like part of that same network, they're all right there. So it just helps the patients and it helps everybody else. So those really took off as well. Here are some of the 5 main types of outpatient care services. So we have clinical services, then we have surgical services, then you have emergency services for acute conditions and whatnot. Then there's home health, and then we got women's health. Okay, so these are continuum of like 5 different types of services that 5 main types of services that will be provided under patient care or outpatient care. Okay, these are different types of freestanding facilities that will provide outpatient care services. So you can go ahead and look at that. Same thing here. This covers home health as well. And then we got hospice, which also counts as an outpatient care service. And I'm sure you guys are all familiar with what hospice is. And here is another list of a variety of different healthcare services and healthcare service facilities, as well as here. Okay, so this has been lesson 7. I hope you guys learned a lot, enjoyed this. If there are any questions, please let me know. You guys can email me. If you have any emergencies, you guys have my number, and also feel free to leave comments down below, and I'll get back to you ASAP. Until the next lesson, enjoy the rest of your day.